بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين. It is 7 December the 2nd and the new version of evidence-based evening about very important, common, timely topic, which is about flu vaccine and COVID era, the myths and facts. And we are very honored to have you, our great audience, along with very distinguished speakers. Before I start the evening, let me share with you few important announcements. We have a very important event coming, which is consultation and communication course, the fundamentals. This is a live event, which we're gonna run it in the Saudi Society of Family and Community Medicine, Eastern Province Family Medicine Hub on the December the 8th. It's gonna be from 8 in the morning till 4 p.m. and 7 CMEs. We have only space for 50 seats because of the restriction with the COVID precautions. This is very special for those who need to improve their communication skill in the clinic, who are having stress when it comes to difficult patient with many active issues, for whether you are practitioner, whether you are a trainer, whether you are a senior resident. It is very timely for those who want to improve and tackle their communication skills. Now, on December 30th of 2020, we're gonna end the year في أمسية من أمسيات تويك Summit Evening with a very important topic. It's gonna be virtual, 2 hours from 7 to 9, about value-based healthcare. Why, what, and how. We invited the national leaders who are handling this important transformational milestone in our journey to 2030 healthcare transformation. We have Dr. Shabab Al-Ghamdi, who is the Secretary General for the Cooperative Council of Healthcare Insurance. We have Dr. Reem Al-Bnayan, who is the CEO for the Center for Improvement Value in Health. And we have Dr. Hussam Al-Falih, who is the Chief Medical Officer, Acting CEO for Program for Health Assurance and Purchase at the MOH. So these three leaders are the people handling the value-based healthcare transformation, and they will be with us at the FM Hub on December 30th, 7 to 9. So make sure to mark your calendar to end the year with a very important things to know for you in your career, whether you are a practitioner, whether you are a owner of a business, or you are a manager in a governmental healthcare sector. In January, we'll start the year with a very important clinical topic. It's going to be one of the nights of the evidence-based evening, where we're going to talk about exercise and physical prescription for disease prevention and health promotion. Again, we invited the leaders for you from whether they are primary care physician, whether they are public health specialists, or whether they are active coach who are prescribing and doing the exercise with the patient. So please mark your calendar. The exact time, the date for this important conference yet to be decided. It's preliminary January 16, but it might be delayed because of the mid-year summer school break. So follow us on the FM Hub Twitter, where we will be announcing the exact timing. So December 8th, the CCC course, December 30th, الأمسية من أمسيات تويك, and sometime in January we're going to have another important evidence-based evening about the exercise. Now let's go back to our event tonight. Tonight, again, as usual, we're going to start the evening with the short presentation from our speaker and expert. Then we'll open the question and answer for almost more than an hour. Please use the question and answer to direct your question. We'll do the best to handle as many questions as we can. We'll start the evening by welcoming our first speaker, Dr. Shada Al-Zuhair. Dr. Shada, we are very privileged and honored to have you. Can you please introduce yourself to the audience?
Thank you, Dr. Hadi. It is my pleasure to have this opportunity to talking during this an important event. I am Dr. Shada Zuhair, Consultant Family Medicine, Director of Al-Mutlaqiya Primary Health Center in Eastern Province. Thank you, Doctor.
طبعا الدكتورة شذا was one of the leaders who established the fever clinic, and she is handling all the issue related to flu, cough, cold, vaccine, and lots of COVID-related issue. We're very privileged and honored to have you, Doctora, with us. Dr. Ali Al-Ghandi, welcome on board, and please introduce yourself to the audience.
السلام عليكم جميعا. دكتور علي الغامدي, transplant infectious disease consultant and director of the infection control department at King Fahd Specialist Hospital at E1 cluster.
طبعا Dr. Ali Al-Ghamdi has the pleasure to work with him during the COVID crisis in the E1, then later in E2. He was the man running show behind the scene with all COVID related clinical decision making. Great job, Abu Muhammad. Yani, one of the leader who really influenced how we did for the E1 and E2. So we're very privileged and honored to have you with us. Dr. Ali, we'll start with your presentation. So the floor is yours.
Yes, assalamu alaikum. The screen واضحة?
Yes.
Screen is visible? Okay. So today we just will start like these are our outlines. What is influenza? And we just talk briefly about the vaccine development, how it works, as well as who should get the vaccine, and also the vaccine benefits, and some misconception about the flu vaccine among the public, as well as the healthcare workers. So let us start. So first of all, what is influenza? So influenza is an acute respiratory illness that affects mostly the upper airway, but it could affect as well in high susceptible patient, lower respiratory tract as well. So we have 4 types of influenza: influenza A, B, C, and D. The one causing epidemic is the influenza A and B. C is like causing very mild disease and is not really linked to the epidemic, so if it's not of clinical significance, as well as the type D, which is actually affecting only animals, the cattle. So the transmission can be aerosols, especially during aerosolizing generating procedures, and however, mostly through droplets and contact transmission. So the clinical illness actually is varied greatly from being asymptomatic to a fulminant disease that lead to mortality. And the usual incubation period is 1 to 2 days and could be up to 4 days, and before the onset of the symptoms after the exposure to the virus from someone who's infected. So this is basically the basic structure of the influenza virus, and it contains 2 major proteins, surface proteins. So this is enveloped RNA virus, and the 2 major proteins are the hemagglutinin and the neuraminidase, HA and NA. So the hemagglutinin is actually, this is the protein that is needed for the virus to enter the epithelial cells. So it will attach to the sialic acid receptors on the epithelial cells, and then the virus will go inside the epithelial cells in a process called endocytosis. And the other important protein, which is neuraminidase, the NA, and this protein is important for the virus to release from the infected cells to other cells. So after it enters the cells, got replicated, and whenever it leaves the cells to infect others, this neuraminidase is facilitate the cleavage of the hemagglutinin protein from the surface of the virus that is attached to the cells, again to go to infect others and so on. So there are different subtypes for each protein. So the neuraminidase is 11 subtypes and named from N1 to N11, and hemagglutinin 18 different subtypes from H1 to H18. And actually there are a potential combination of around 198. However, 131 subtypes have been detected in nature. So the current subtypes of influenza A that is routinely circulate is the influenza A H1N1 and influenza A H3N2. So why we are talking about this, the structure of the virus, because it's very important to understand this concept. So to know exactly how the virus is made and why this virus vaccine and being every year being changing. Because of the change in the sequence of the protein on the surface of the virus itself. So the virus is continuously changing as the nature of the most of the RNA virus, where like they tend to mutate more frequently than the DNA virus. So the surface protein, the hemagglutinin, is changing frequently along with the neuraminidase. And this is like what we call antigenic drift. With a minor change in the sequence of this protein, give it a new like envelope, a new virus. That's why the vaccine's composition need to be changed every year to match the most likely circulating circulating virus in the upcoming season. So there is another term called antigenic shift, where like there is a major change on the surface protein of HA and NA to a new virus. And this is shift, which is what happened lastly with the H1N1 in 2019. And that was antigenic shift. So what we used to have every year is the antigenic drift with a minor change in the sequence, as I mentioned earlier. For that reason, so what is happening every year, like the CDC, WHO partners as well, in more than 100 influenza centers in more than 100 countries all around the world. Actually, they are submitting the influenza strain circulating in that area. So through the global influenza surveillance and response system, then based on the informed guess, there's a meeting that is like held twice a year in February to make what is the likely the strain that will be circulating for the coming season in the Northern Hemisphere. And there is another meeting also take place in September to have again the informed guess about what is the likely circulating vaccine in the Southern Hemisphere. So after like they need 3 days for each meeting to come up with the decision about it, then they will give it to the private manufacturer, where they have the candidate vaccine, virus vaccine, the CVVS. Then they will just do the manufacture based on the selected vaccine. So here in DC, this is a sketch that they will have the circulating strain along with the master high growth strain that facilitate the growth in embryonated egg. Then later on, they will do the selection about what is the antigenic type of the most likely strain that could be circulating. Then they will do the amplification by putting much of these strains in a lot of eggs that is prepared in a way that is suitable for having this harvesting, actually, like this virus. Then they will do the inactivation using ankylating agent like formalin or others, then purification. Also, they will do a split where they split the virion itself, and this will make it less, like less reaction to it, and more tolerable to be used at the end once they finish the production. So this is actually basically what they call it egg-based flu vaccine, and we do have also cell-based and recombinant vaccine, but this is the method that has been used since more than 70 years. So as we mentioned, we have Northern Hemisphere. We are getting the vaccine of Northern Hemisphere, and we have usually two components. Mostly now is like the quadrivalent, where we do have influenza A, H1N2 with its the antigenic variant, as well as the influenza A, H3N2, and the two lineage of the influenza B. And actually, there is no any preference or recommendation which to use, the trivalent or the quadrivalent. So this is how it does it work. Like the antibodies, that is a specific antibody against the strain selected. It will attach to the hemagglutinin, so it will neutralize the virus, so the virus cannot enter the cell. So this is the way. So this antibodies that, like in the vaccine, is actually specific, as I mentioned. So if that hemagglutinin is not matching the antibodies is prepared specifically for that specific strain, the match will be not good. So probably it will not protect against that particular strain. So who should get the vaccinated? Everyone 6 months of age and older should get the vaccine. And the people at high risk for getting complication are the priority, including older age, 65 years and above, and also pregnant women at any stage from the first to third trimester, young children less than 5, chronic lung disease, asthma, COPD, and also other chronic diseases, the heart, liver, and kidney. Diabetes also, they are at high risk. Cancer patients, of course, and other immunosuppressed host HIV and transplant recipient. All those are at high risk. However, the recommendation is to give everyone the vaccine with prioritization for the high risk group, since they are the people who are at risk to have a serious complication whenever they get the influenza. So what are the vaccine benefits? There are different benefits. Well, first of all, let's discuss about its effectiveness. And this question is very common being asked by our colleague, whether really like the vaccine is worth taking, is it really effective? So getting the vaccine is just basically to prevent you from getting sick with the flu. But how is this vaccine is effective? So if you see here in this diagram, is actually, this is from the CDC about the estimated effectiveness of the vaccine since 2009 till now, with some like in range between 40 to 60%. And you've clearly noticed here in 2015, there is the efficacy, the effectiveness was low, about 20, because at that time the virus did like change after they manufactured the vaccine, and that's, so the match was very minimal, so that was no one really protected by the vaccine when it was launched at then. So it's like all the effectiveness is actually principally related to the match with the vaccine that is prepared for the most likely circulating influenza during that season. Very important concept to know that the efficacy versus effectiveness. So when you're talking about efficacy, that means this is done in a controlled condition, randomized controlled trial, where they do have people getting the vaccine, other people are just getting the placebo. And the effectiveness, when we're talking about the observation, real world observation, where we do observe the people who are getting sick because of flu, either hospital or physician visit, outpatient, or hospitalization, and compare it to the previous season. It's just more likely of observation. So the efficacy is not anymore like recommended, and definitely it's not ethical after the cumulative evidence and of benefit from the vaccine for high risk group. So it's not ethical to randomize them to a placebo. So what we are seeing now is just basically more of effectiveness, like a statement about the vaccine. And the CDC typically present the vaccine effectiveness as a single point estimate rather than a range. So for every season, there is like fixed percentage. Let us say this year, the effectiveness is 60%. So this is translated that you are 60% less likely and to get flu if you get the vaccine. So this is how we would say it. So one of the benefits of the vaccine, of course, to decrease the hospitalization, children and adults, as well as the elderly, by about 40%. And this is one of the systematic review and meta-analysis of test negative design. And without going to detail, this is a design called test negative, is a variant and modified design of the case control, where they try to eliminate the confounding related to modeling during the study itself. And now that trial did show actually 40% reduction in hospitalization among all these groups. So other benefit also of vaccination is like the admission to the ICU is reduced by 82% among adults, and also by 74% reduction in the PICU admission for children with two recent trial, and about actually the confirmed influenza, the RT-PCR. So there are older study actually that was like based on the serology, but that actually it may overestimate the effectiveness and also the clinical impact. However, these two trials was actually based on the clinically confirmed illness by the PCR. So other also important, among the important benefit of the flu vaccine is definitely lower rate of cardiac event like heart attack, worsening heart failure among those with underlying heart disease, and especially for those who had a cardiac event in the past year. Also, to reduce the hospitalization and the severity of exacerbation of chronic lung disease like the COPD and also asthmatic patient. In addition, also reduced overall hospitalization among people with diabetes and again with chronic lung disease. So flu vaccine help protect women during and after pregnancy, and one of the trial in 2018 actually showed a 40% reduction of hospitalization in average in pregnant women who got the vaccine. And this is one of the multi-country retrospective trial, again with negative design study published in 2018, clearly stating the benefit and effectiveness of this vaccine in this high-risk group. And overall, also there is a reduction in the severity of the disease and acquisition of the respiratory infection, lower respiratory tract infection among pregnant women by 1/2 for those who got the vaccine. In addition to the benefit of the many other studies show the benefit that protect actually the baby from flu for several months after birth, since like babies less than 6 months, they are not candidate to receive the vaccine. Basically, it will not work. However, they can get the antibody passively through their mothers who got the vaccine during the pregnancy. So the flu vaccine can be life-saving in children, and this is first of its kind trial published in Pediatrics in 2017. And actually, like that trial showed a significant reduction in the risk of children to die from the flu, and that the effectiveness of reduction in that trial was actually 65% effectiveness of reduction of death that's attributable to influenza infection in that group. So flu vaccine has been shown several study to reduce the severity of the illness for the people who get the vaccinated but still get sick with flu. And in 2017 trial showed reduced death, ICU stay, and admission, and overall duration of hospitalization for people who got the vaccine, yet they also became ill with the influenza at the end. And also another trial in 2018 showed those who got the vaccine were like 59% less likely to be admitted to the ICU. So even though they got the flu, however, among those who received the vaccine, still their clinical illness severity, admission to the ICU, and even the hospital stay length were reduced for those group who took the vaccine. So here we just discuss few misconceptions about the vaccine. Can a flu vaccine give you the flu? The answer is basically no. The flu vaccine cannot cause flu illness. The vaccine is actually inactivated, killed virus. And so yet it's not infectious, and the aim is just only to trigger the immune system to produce the necessarily antibody for that specific strain. And that's also true for the live attenuated vaccine, which is a weakened virus, not able to cause an infection, even if it is weakened and live. So why do some people not feel well after getting the seasonal flu vaccine? There could be a common mild reaction to the flu vaccination, like soreness, redness, tenderness, or swelling at the injection site. And this is quite common, maybe 10 to up to 20%. who will get this reaction. However, when we are talking about systemic symptoms like low-grade fever, headache, and muscle aches is really rare, like we're talking about 1%, and that's more like noticed for the children rather than the adults. And one of the trial actually control trial placebo versus those who get the vaccine. Actually, there is no any difference between the placebo group and the group who received the vaccine in terms of developing systemic symptoms like the fever and headache, muscle ache for adult group who received the vaccine. So there is no any difference from the placebo who did not get the vaccine. So the reaction, even if it happened, and it will take very short time, it just maximum 1 to 2 days, and usually it's mild and resolved by itself. So what about people who get a seasonal flu vaccine and still get sick with flu symptoms? I think this is, if I would choose as one of the most important misconception and most important question actually to answer clearly, and for our colleague and for the public as well. And because this is one of the common reason people refuse to get the vaccine. So the explanation, it's only 3 options, 3 possibilities. First of all, becoming ill from other respiratory viruses. This season, not only the influenza virus, it circulates many other viruses. It's a very long list of viruses that have similar presentation to influenza. That could be the reason for having the symptoms, not necessarily the influenza itself. The second explanation, that exposure to influenza viruses shortly before getting vaccinated or during the 2-week period after the vaccine. So let us say someone got the vaccine today, and after 1 week they develop influenza. Even if it's truly confirmed influenza, that doesn't mean that the vaccine causing this flu or the vaccine was not working. Because that wasn't early on getting the vaccine. There's no enough time for the body to develop antibody necessarily to protect against the flu. So the timing is also very important to comment about it. So the third explanation, that someone could be unlucky that the virus circulating during that season has poor match with the vaccine that you got. So it's totally different strain of the circulating influenza vaccine. That's why, because again, as we mentioned, the effectiveness around 40 to 60%. So there is a chance also that you might not be covered, especially during that season where the flu vaccine does not match the circulating strain of the influenza. So this is very important to know, because to have a clear explanation why some people still having flu symptoms despite that they received the vaccine, and that will really eliminate some misconception about the effectiveness of the vaccine itself. So is it better to get the flu than the flu vaccine? The answer is no, basically. Flu can be a serious disease, and any flu can carry a risk of serious complication, hospitalization, death, or death, even among otherwise healthy children and adults. And according to World Health Organization, the annual epidemic are estimated to result in millions of up to 5 million of severe illnesses and tens of millions of other milder disease. However, up to 650,000 respiratory deaths. Yet, more than 75% of those who died because of the respiratory death, more than 65. However, that let us we have another 25% for those younger age group, yet they had severe illness or even death because of the influenza. So getting vaccinated is a safer choice than risking illness. So do I really need a flu vaccine every year? The answer is yes. The CDC recommend a yearly flu vaccine, even when the vaccine virus have not changed from the previous season. And basically the reason, because the immunity declines over time. And even if it's the same strain used this year, you will get the best out of the vaccine by pushing more, it will be a best protection for you if you get the new vaccine, and then the antibody level and the titer will be to the optimal level for a better protection. So post-vaccination seroprotection rate is one of the review of about 8 trials in elder patients above 60, and the seroprotection level were maintained for more than 4 months, and that is mostly for the H3N2 strain, to a lesser extent the H1N1 and the B component of the influenza. Okay, so get your flu shot today and protect yourself, your family, and your patients. Thank you so much.
Thank you very much, Dr. Ali. Very informative. So if I might summarize the excellent presentation, basically, it is effectiveness is 40 to 60%, decrease the mortality rate in adult up to 40%, decrease the admission rate in adult, and decrease mortality rate in young children. It is indicated in all 6 months above, and the high risk group are especially recommended to have it. Thank you very much. Now we'd like to hear more about the flu vaccine, and even maybe we go over some of the same condition mentioned by Dr. Ali, by Dr. Shada Zuhair. So we want to hear the primary care perspective from Dr. Shada Zuhair. The floor is yours, Dr. Shada.
Assalamu alaikum. I will start my session, but I cannot share screen.
Dr. Ali, can you stop sharing the screen? How about now?
Yeah. Okay, thank you very much, Dr. Ali, for this very knowledgeable and informative presentations. I will continue today this event with my outline this session. I will speak about little bit about influenza and pregnant ladies, because this is an important one, and with immunocompromised patients also who should avoid the vaccine, and what is the best time to take the vaccine, and what is the relation between flu vaccine and COVID-19, and the difference between influenza and common cold. What is the other effective measurement and intervention to prevent or fight the influenza? A little bit some statistic about the influenza. I'll start globally. Worldwide annual epidemic result in approximately 1 billion cases of influenza, about 3 to 5 million cases of severe illness, and about 250,000 to 500,000 deaths per year, with an attack rate 5 to 10 in adults and 20 to 30 in children. The incidence of is often underreported, since the illness may be confused with other viral illness, and many people with influenza-like illness doesn't seek a medical care or have a viral diagnostic test was done for them. Regarding Saudi Arabia, the latest WHO data published in 2018, influenza and pneumonia death in Saudi Arabia reached up to 6,000 of total death, with death rates around 43 per 100,000 of population death. And all we know face a unique and challenging situation during Hajj and Al-Umrah season, when 1 million of people gathering at a holy place in Mecca and Medina, during which influenza outbreak are commonly found. Such a challenge make the adoption of strict vaccination strategy in Saudi Arabia is a great important, and influenza vaccine are offered free of charge, as we know, for all populations, Saudi and non-Saudi. And all of now also we start the flu season with the change in the weathers, and many people are worried about the twin threat of influenza and coronavirus. Dr. Ali already speak about the pregnant women, but I will focus in some point. All women who are pregnant or who might be pregnant during the influenza season should receive influenza vaccine to protect them during and after pregnancy. A pregnancy usually increases the risk of complication of influenza due to alternation in heart rate, lung capacity, and immunological function, and associating with miscarriage, premature birth, and reduced fetal growth and stillbirth. Vaccination during pregnancy provide a passive immunity to the infant during the first 6 months of life, when a baby are too young to receive the influenza vaccine. And what type of vaccine we can give the pregnant lady? We can give a quadrivalent influenza vaccine that is named as flu shot, and we couldn't give live attenuated vaccine as a nasal spray. In 2018, study of external icons showed that getting a flu vaccine reduced pregnant women risk of being hospitalization with the flu by average of 40%, and there is a large body scientific study that support the safety of flu vaccine in pregnant women and their babies. Multiple also studies have shown that women with have getting a flu shot during pregnancy have not have a high risk of spontaneous abortion. And when we can give a vaccine to the pregnant women, any stage of pregnancy, because a lot of pregnant lady come with wrong concept about it is dangerous during the first trimester. So we said for them it is safe, you can take it at any stage. This slide talk about a vaccine often offered, but many pregnant women and baby left unprotected. This graph shows the percentage of women who report provider offer or referral for flu vaccine and Tdap vaccine from CDC internal panel survey 2019. Most of 75% women report provider offer or referral for flu and Tdap vaccine, and only 25% report that they had not been offered or received referral for flu and Tdap vaccine. Another one show the flu and Tdap vaccine coverage for pregnant women. Most women report receiving Tdap vaccine around 55%, and 45% receive influenza vaccine, and regarding for receiving both, only 35%. Okay, we'll shift to talk about women vaccinating during pregnancy pass protective antibodies to baby from CDC internal panel survey 2019. Pictures of women pregnant and the fetus about 2 weeks after vaccination. The mother developed antibodies to vaccine, and antibodies enter the placenta to transfer to the baby. Another pictures of women holding the baby show the baby is born with antibodies to provide and give protection against influenza for the first few months of life, up to 6 months when his immune system is weak, and we couldn't give the vaccine regarding the influenza. I will go now with the flu vaccine regarding immunocompromised patient. The live vaccine should not give to the patient with immunodeficiency. Also, family member or household contact should not receive live vaccine, as they may transmit the virus to the immunodeficiency family members. It is important to emphasize that all patients with immunodeficiency and all members who of their family or other household contact should get a killed vaccine for influenza to reduce their risk of developing influenza and transmit it to the patient with immunodeficiency. Although there is a chance that some patients with immunodeficiency might be blunted immune response to the vaccine and might be reduced or minimal as a result of medication, chemotherapy, or transplant regimen. As we know, the immunodeficiency patients have decreased resistance to infection, often have repeat infection or coupled with infections that are more severe and causes unexplained complications. Who should avoid the vaccine? Who should avoid? We have two types of vaccine. We have a quadrivalent influenza vaccine and we have a live attenuated vaccine. First, I will talk about the quadrivalent influenza vaccine. Those with a history of anaphylaxis to previous dose of influenza vaccine or any constituent and a patient on combined checkpoint inhibitors because of potential associating with immune-related adverse effect reactions, and patient with severe neutropenia. What I mean by severe neutropenia, decreased absolute neutrophil count. Who should avoid life-attenuated vaccine? Children younger than 2 years, or adults 50 years and older. Children 2 years through 70 years old who are receiving aspirin or salicylate-containing medication. Children for 2 years through 4 years who are old who have asthma or have a history of wheezing in the past 12 months. People who care for severely immunocompromised patients who require the protective environment. Also, pregnant women and people with active leak between cerebrospinal fluid and mouth, nose, ear, or other place within the skull. And people with cochlear implant, people also who taking flu antiviral drug with a previous 48 hour for oseltamivir and zanamivir, and previous 5 days for birimavir, and previous 70 days for baloxavir. Also, I will add some point regarding people with severe allergic reaction to any ingredient of a vaccine or previous dose for influenza vaccine, and also people with without spleen or non-functional spleen. Who precautions or we precautions when we give the influenza vaccine regarding quadrivalent influenza vaccine. That's with acute febrile illness. If the temperature is more than 38, we defer the vaccine until recovery, and the quadrivalent influenza vaccine should be separated also from a pneumococcal conjugated vaccine by at least 1 week for children aged from 12 to 23 months because of slightly increased risk of febrile convulsion if the vaccine are given at the same time in this age group. And regarding life-attenuated vaccine, asthma in people's age 5 years and older, other underlying medical conditions that can put people at high risk of serious flu complication. This may include lung disease, heart disease, kidney disease, liver disorder, neurological and neuromuscular or metabolic disorder. Also, moderate to severe acute illness with or without a fever. The last Guillain-Barré syndrome with a who have within a 6-week following a previous dose of influenza vaccine. A lot we ask about if the patient they have egg allergy, it's a contraindication to give them a vaccine. We said the quadrivalent influenza vaccine have a low over-albumin vaccine with an over-albumin content less than 0.06 microgram per dose. People with confirmed egg anaphylaxis or egg allergy can be given quadrivalent influenza vaccine that available in the all primary health center and hospital with an over-albumin content less than 0.1 microgram per dose in a primary care setting. So we can give and save influenza vaccine. Now we shift about the best time to take the vaccine. There is no change in CDC recommendation on timing of vaccine for this flu. Usually September and October are a good time to get a vaccine. Usually also the vaccination too early in season maybe in July or August may lead to suboptimal immunity later in season, particularly among older adults. Antibodies usually start in a body after 2 weeks of influenza vaccine. Regarding the situations, does it work regarding a COVID? We said getting a flu vaccine will not protect against COVID-19. However, flu vaccine has many other important benefits which have been shown to reduce the risk of a flu illness, hospitalization, and death. Getting a flu vaccine this fall will be more important than ever, not only to reduce your less risk from flu, but also to help conservative, potentially scarce healthcare resources. For those who have acute illness with suspect or confirmed COVID-19, clinician can consider delay vaccine until the patients are no longer actually ill. If influenza vaccine is delayed, patients should be remained to return for vaccination once recovered from COVID-19. The newly published results have found evidence to suggest that vaccine might also offer protection against COVID-19. Two studies carried on Italy and Brazil involve more than 100,000 people found the vaccine reduced the number of coronavirus-related hospital admissions. What is the difference between cold and flu? Flu and common cold are both respiratory illness, but they are caused by different viruses. The flu and cold have similar symptoms. The difference is how intense they feel and how common they are. In general, symptoms of flu appear quickly, while symptoms of cold happen slowly. Flu is worse than a common cold, and the symptoms are more intense. Cold are usually milder than a flu. People with a cold are more likely to have runny or stuffy nose. Cold generally not result in general health problems such as pneumonia, bacterial infection, or hospitalization. The flu can have very serious associating complications. How we fight the flu? A part of a flu vaccine, the other effective measurement starts, as we say, the first thing, the vaccine, CDC recommendation, yearly vaccine as a first and the most important step in protecting against influenza virus. Vaccine of high-risk people is especially important, we repeat again, to decrease the risk of severe illness. People with high risk of serious flu complications include young children, pregnant, people with certain chronic conditions like asthma, diabetes, heart and lung disease, or people more than 65 years old. Many people at high risk of flu also seem to have a high risk of COVID-19. Vaccination also is important for healthcare workers and other people who live with or care for people at high risk to keep them from spreading flu to them. Taking every day preventive action to stop or spread of germ. Take everyday preventive actions that are always recommended to reduce the spread of the flu. Avoid close contact with the people who are sick. If you are sick, limit a contact with others as much as possible to keep from infection, infecting them. Cover your cough and sneeze. Cover your nose and mouth with a tissue when you are cough or sneeze. Throw the tissue in the trash after you use it. Wash your hand often with the soap and water. If the soap and water not available, use alcohol-based hand rub. Avoid touching your eyes, nose, mouth. Germ spread in this way. Clean and disinfect surface and subject that may be contaminated with a virus that can cause influenza. For flu, CDC recommends the people stay at home for at least 24 hours after their fever is gone, except to get for any medical care. The last thing, in the context of COVID-19 pandemic, may you need to prescribe antiviral if you are sick with the flu. Antiviral drug can be used to treat your illness. Flu antiviral drug not designed to treat a COVID-19. Antiviral drug can make flu illness milder and shorter. The time of the sick. They may also prevent a serious flu complication. For people with high risk factor, treatment with antiviral drug can be mean the difference between having milder illness versus very serious illness. Studies show that flu antiviral drugs work best for treatment when they are started within 2 days of getting sick, but to start them later can still be helpful, especially if the sick person have a high risk factor or very sick from flu. This is the reference, already take the session from it. And the last thing, the flu end with you. So protect yourself and get flu shot. Thank you very much.
Thank you very much, Shada. Now we'll go to the question and answer. The audience, please feel free to share all the question that you have through the question and answer, and we'll go as much as we can for those who haven't been answered through the lectures. Dr. Shada, stay with us. Dr. Ali, stay with us. Please feel free to jump in. It's an open dialogue. You mentioned two vaccines, Dr. killed vaccine or live attenuated vaccine. Now, what do we have available for clinics, for MOH or for the private sector? Is it the killed or we have the two strain, the killed and the live attenuated?
Okay, doctor. This is important question because a lot of people come to ask about this point. Actually, we have in the primary health center, we have a quadrivalent influenza vaccine. This is a killed vaccine. So it is safe. We can give to any patient come to the primary health center.
So, Dr. Ali, do we have anywhere in the healthcare system in the Saudi in our health system the live attenuated or it's mainly the killed virus, just to clear any potential concern that typically comes and asks from the audience? You are muted, Doctor. Dr. Ali, you are muted.
Yes, up to my knowledge, we do have only the inactivated, the killed vaccine. The flu mist, the nasal spray for the live attenuated, we don't have it. Excellent.
So just to get everybody at ease, what you gonna prescribe or receive, it's gonna be عندنا في الcountry, it's gonna be the killed vaccine. So you don't need to worry about the precaution about the live attenuated vaccine, unless somebody is telling you to take it through the nose, then that's the live attenuated. Is that a correct statement, Dr. Shada, Dr. Ali?
Yes, exactly, doctors. Yes. The live attenuated vaccine given by nasal spray, a killed vaccine by injection.
Excellent. So you don't need to worry about majority of the precaution because what we have currently عندنا في الkingdom is the killed vaccine. Excellent. Dr. Ali, one of the points discussed by Dr. Shada is febrile illness. She mentioned that the severe febrile illness. So majority of the patients who would present with flu, minor cough, cold, runny nose, are we okay to give the vaccine? Do we need to send them back and come back in a week later?
Yes, it's recommended that any acute febrile illness not to give the vaccine during that period for whatever illness that they do have. So because sometimes they could have like a reaction related to the vaccine itself, and that will be add on to whatever they do already have. So that window is not really preferred to give the vaccine at, and waiting like once the fever subsides and the illness is over, it's the more suitable time window for the convenience and the comfort while giving the vaccine itself. But the fever will not really impact the effectiveness of the vaccine itself, but rather than giving it in a time that is really preferred and convenient for the patient whenever they are planning to take the vaccine. And I would like to mention also one very important point. So now we are in the pandemic of the COVID-19. So also sometimes we get a question whether those who are suspected COVID, yet they don't have major symptoms or fever or any other, it's really, can we give them the flu vaccine? The answer is no. So the recommendation now, whoever suspected COVID or active COVID confirmed, we need to wait till they recover as per the definition of the recovery, which is basically 10 days from the onset of the symptoms of corona. Then once they are recovered, they are eligible to take the vaccine. Even if they are suspected with mild symptoms, also it's not recommended to give the flu vaccine till they clear the corona, then they can receive the vaccine.
Okay, so I just want to restate because we got two questions from the audience about, so if somebody tested positive or suspected with COVID, we should delay giving them the vaccine till they recover from the COVID disease. Is that correct statement?
Correct statement, exactly. So they need to recover according to the recovery definition, then they will receive the vaccine.
Can you, Dr. Ali, briefly tell us what is the recovery definition so our audience can have clear knowledge about what we are talking about?
Yeah, so the recovery basically defined as 10 days from the onset of the first symptoms till 10 days at least, provided that the 3 days elapsed since they are free or at least improved from perspective of the respiratory symptoms. So they don't have cough, they don't have shortness of breath, and there is no fever for at least 3 days. Those 3 days, just to clarify this one, because some people they get confused. These last 3 days could be within the 10 days period from the onset of the symptoms, or could be add on. So let us say like they took 10 days, they still have symptoms. Even if they pass 10 days since the first onset of the symptoms, they are not recovered. We need additional 3 days where their symptoms improved much greatly with no fever, without using antibiotics, no cough that's persistent, and no shortness of breath. So some, they could even take 2 weeks, they continue to have the symptoms, add to it additional 3 days with symptoms free and improved, that will be at the end 17. So the 10 days from the onset of the symptoms is the minimum duration that we require for someone with COVID to be recovered. Add to it 3 days, the last 3 days with no respiratory symptoms, no fever, without using antibiotics, that could be in the last 3 days of the 10, or could be added to it, whether if they continue to have the symptoms during that whole period.
Excellent. Dr. Shada, you clearly stated in your presentation that it is okay to give the flu vaccine during any stage of a pregnancy, whether first, middle, or last trimester. Can you confirm that my understanding is correct?
Yes, doctor, because a lot of patients come with concerning about this point with misconception that the first trimester is contraindication to get a vaccine. But we said to them, at any stage from getting pregnant, from first day until delivery, it is safe to take a vaccine with a killed vaccine, I mean quadrivalent influenza vaccine, that is a killed vaccine, with no harm for a baby or for her.
Can you help? Because I've been through this myself. Like I got a close friend who got pregnant, and then I asked her, she asked me specifically about the flu vaccine. I directed her to healthcare center and not here in somewhere to receive the flu vaccine, and they refused to give the flu vaccine. Is that a misconception, or there's certain pregnancy-related condition that we should avoid the flu vaccine?
No, doctor, it is safe at any stage, at any condition of a pregnant baby. It is she can go directly to the primary health center and she can give the vaccine.
Okay. Dr. Ali, somebody who is taking...
Can I comment, Dr. Hadi, about the pregnancy as well? You know, like I totally agree with Dr. Shada, because this is totally safe from the... But I believe maybe one of the misconceptions is about the autism. So one of the small trial, like 2 small trial that showed some increase, but actually that was like not true anymore, because multiple large trial done later on, especially one trial even published recently, Swedish trial, actually showed there is no any risk at all, even in the first trimester. And they evaluated 40,000 pregnant women. And that is consistently, the vaccine showed the safety, and even there's a conception of the autism is not anymore valid. And it was a history based on a true, very small trial with a lot of like methodology related concerns in that 2 trials, followed by multiple large trial confirming clearly there is no any association from the background rate related to the autism for any pregnant woman who received the vaccine, even in the first trimester. Some people, they do carry like old concept about the vaccine, but however, like as you go through all the literature, the experience, the millions of the vaccines given in a well-controlled trial, and you see actually there is no any increase in the risk if they got the vaccine itself.
Excellent. Thank you very much. Dr. Shada, you mentioned, and I'm just repeating because there's so much question we get either through now live as we see, or even through the day-to-day practice. The anaphylaxis reaction to egg is not contraindication to killed vaccine, flu vaccine. Is that correct?
Yes, doctor. Any patient with egg allergy, they didn't need a hospital admission to ICU. It is safe to get a vaccine because the ova-albumin in the vaccine, quadrivalent influenza vaccine, is less than what they get have. Less than 0.06, what the safe dose for them less than 1. So safe to take vaccine at any stage, but if they have last vaccine allergy, severe allergy, need admission to the ICU, better to not take it.
So let's forget the live vaccine. So the killed vaccine, unless they admitted to the hospital ICU because of the egg allergy, they still can take it.
Yeah, unless they required admission to critical care or ICU admission for a previous severe anaphylaxis to the shock, they better to not take it.
Okay. Dr. Ali, we get a few questions, 2 scenarios. Patient with ulcerative colitis taking Humira every 2 weeks. Patient with rheumatoid arthritis on steroid. Can we give them the flu vaccine?
Yes, so the flu vaccine, as we mentioned, that we are using is the inactive, or I mean the killed vaccine. So even those who are on chemotherapy, cancer therapy, that is much more potent, generally speaking, than the immunomodulatory agents used for the Crohn's disease and others, we could still give them the vaccine, even like if they are in the hospital and receiving, provided they don't have an acute febrile illness. So the answer to the question, yes, there is no any contraindication, even if they are receiving a biological treatment, even if they are a cancer patient, even if they are transplanted in a triple immunosuppressive therapy, the inactivated is safe. Actually, it's advocated to be clearly given for those patients, actually, because they are high-risk group and they will benefit much more from the vaccine than not giving them the vaccine because of any possibility of or concern because of the vaccine in a setting where they do receive such immunosuppressants.
Thank you very much. Dr. Shada, you mentioned one of the contraindication, and correct me if I get it wrong, for the killed virus, called the QIV vaccine, the combination checkpoint inhibitor. What is the hell that mean? Let's explain in simple language. Who are these patients that we should avoid or be careful when giving the vaccine? How common? What's the condition so audience can understand the condition that we are referring to?
Yeah, will take any combination therapy that is causes inhibiting of the immune system in the body can contraindication to give them influenza vaccine. What I mean, these patients with maybe chemotherapy with other medication, you should not give them the influenza vaccine because they have low immunity and they didn't, maybe they have a complication of the vaccine.
So are you referring to the kill vaccine or to the live vaccine?
Kill vaccine.
So my understanding, Dr. Ali, we can use it in patients who are immunocompromised. Can we just clarify this point? Can we agree on a statement?
For me, the question, Dr. Hadi?
Yeah. So I understand from you that it's okay to give it an immunocompromised patient who is immunocompromised. Dr. This is something about combined checkpoint inhibitor. We just need to clarify it to the audience. What you would have to.
Yeah, the response to the vaccine, the immunogenicity of the vaccine, it might not really be of help for those patients. But the concept of giving it for being immunosuppressed, a killed vaccine, like inactivated, it can be given with no any contraindication.
So the main point, correct me both my speaker, if some patient on immunocompromised, regardless of what is the immunostatus, they can be given the killed virus. The efficacy may be different, but the being immunocompromised is an indication rather than contraindication to the kill virus.
Correct. So like, you know, the immunogenicity, the way like they respond to the vaccine and they produce the enough antibody to a level that could protect them is really affected in those category of patients. But that does not mean they should not get the vaccine. And indeed, they are not a contraindication. In fact, they are one of the important indications to give the vaccine. So sometimes what they do, like they do actually the double dose, like there are some brand of the vaccine, which is like quadruple amount of the hemagglutinin is available in the vaccine itself to much more induce the system, their immune system to produce. Actually, you give them even the higher dose of the vaccine itself to induce the immune system to produce the enough antibodies. So again, just to clear it, those are high risk. They actually are in need for the vaccine much more than others. And one of the questions I would just like to emphasize, a very important question, and even Dr. Shada mentioned that point as well, even the recommendation is not to give immunosuppressed high-risk group only, but even everyone above the age of 6 months. In fact, if you live with someone who's immunosuppressed, elderly, transplant at home, you might actually transmit the virus to them and cause all the morbidity. The thing that is very important to know that you could have the infection without having any symptoms at all. And even if you have a symptoms, you are infectious to them 1 day before the onset of the symptoms and up to 4 to 5 days after getting the symptoms from the infection itself. So you could transmit the infection to them even without knowing that you are transmitting a virus to them. So the protection here is not just only for you, the one who is really immunocompetent and healthy, but also to protect the one around you who are at risk and complication whenever they get the influenza infection.
Excellent, excellent. دكتورة شادة, بالنسبة للبيدياتريك, you mentioned that above 6 months they can receive the vaccine. And then how many doses the pediatric will need versus the adult?
Okay, doctor. Regarding the 6 months up to 3 years and a half, they can, and the first time receive of the flu vaccine, they need 2 doses. Each dose, half a dose recommended for them. And after 3.5 years, 3 years and 6 months, they can receive full doses. If they not received it before, they need 2 doses influenza vaccine 1 month apart from them, up to 8 years. And from 8 years and above, they need only 1 dose of influenza vaccine, even they didn't receive it before. So in the summary, from 6 to 3.5, 2 doses of influenza vaccine 1 month apart, and with a half a dose, and from 3 and 6 months up to 8, full dose of influenza twice, 1 month apart, and from 8 years and above, 1 dose of influenza, even he didn't receive before.
Excellent, excellent. We got lots of questions, Dr. Ali. Somebody who went to, say, for Hajj earlier, and they received the flu vaccine, and now we got the new version of the flu vaccine. Should they receive it, or what? That was good enough?
Yes, even if they receive like a vaccine that is not the current one, or a vaccine that is actually not related to the hemisphere, like someone who like traveled to a country in the southern hemisphere. So because of the location and the type of the vaccine or the expiry or anything, they could get the vaccine with no any harm, at least like 4 weeks apart. That is more than safe for them to receive the updated vaccine. And that does not at all contradict if they receive the vaccine that is not suitable earlier.
Excellent. So somebody who did not receive the vaccine, and now we are January, should they get the vaccine or wait for another version?
Actually, like they should take the vaccine as long as the virus is circulating in the community. This is an indication. Even you can take it up to some, like in the northern hemisphere, you could reach even up to May. Like, so in April, February, if the virus is still circulating, still it's not too late to get the vaccine, but definitely the preferred timing, as Dr. Shada mentioned, is to get it like in October or end of October, not earlier. And but if the virus is ongoing, circulating in the community, they can take the vaccine, and that vaccine prepared actually to cover the whole season, which is like the forecasting from the forecast about the type of the influenza vaccine is from October till May. So they are still within the covered period for that.
Excellent. Dr. Shada, I'll go to pregnant ladies and the flu vaccine again, just because we have so many misunderstanding in the community about the flu vaccination in general. Let's say a lady who needs to take the tetanus for the during her pregnancy. Can we give the flu vaccine at the same time, or we have to book them again for the vaccine?
Come on, doctor, what's the question? The flu vaccine with what?
So a pregnant lady who's going to receive the tetanus, can we give the flu vaccine at the same time, or we need 2 appointments? Like we bring her later, or we can, there is no contraindication to do both?
No, doctor, there is no study show any contraindication between both vaccines. She can take it at the same time.
Excellent, excellent. And I just want to re-emphasize, because I'm still getting the text about the, my understanding, flu vaccine safe regardless of the gestational age, first, middle, or late trimester. And in the late trimester, my understanding that it will give some immunity to the baby. So even the lady, she's going to deliver within 2-3 days, you still give it the vaccine. Is that correct, Dr. Shada?
Exactly, doctor. Give immunity to her baby up to 6 months of the after delivery.
Excellent, excellent. في question, Dr. Ali, somebody who recovered from the COVID, and they still have this remnant of symptom of cough and shortness of breath. They did the chest X-ray, it's improving, but still they got the cough and shortness of breath. Again, is that a contraindication for the flu vaccine? Can they get the flu vaccine?
Okay, so first of all, quickly, I will just explain why they do have such symptoms persistent. And the second question, whether really it's contraindication or not. So like COVID-19, the coronavirus, like any other respiratory virus, actually, they have some effect on the respiratory epithelial cells and the airways, and they could lead as one of its complications to hyperreactive airway disease post-viral infection as a sequelae, as a complication of the infection. Doesn't mean they do have an active persistent infection throughout. Some they could have cough and for like several weeks, and even some of them they would use inhalers just to improve the transient hyperreactive airway disease to like subside with the use of the after the infection of the corona or other respiratory, which already like recovered. It's not active, but what we are seeing is the sequelae and the complication of it. So what is happening as a complication secondary to it is definitely not a contraindication to get the influenza vaccine, which has nothing really basically to do with the corona or the sequelae that happened after the corona infection.
So it's safe to go ahead and give it with these symptoms. Excellent.
Yes, that's it.
Let's say somebody, Dr. Shada, who got vaccinated, جاله في clinic وأقنعتيه وأخذ الفلو vaccine. Unlucky, جاله COVID. Is that by any chance gonna make his course of illness worse, better, or maybe now big difference in his COVID illness?
Okay, regarding the COVID, there is a lot of benefit of flu vaccine because it reduces the number of COVID complicated hospital admission. So it's better to take and safe of flu vaccine, even if the COVID disease come later. So no any worry regarding the flu vaccine if you get any COVID disease.
Okay, so it's it's okay even if they got recovered, they just bad luck.
Yeah.
Okay.
Exactly, Doctor. Yes.
How long, Dr. Ali, will delay the fever? Is it till they are recovered from the febrile illness? Is it time specific or just the minute they recover from the febrile illness?
So you mean like when to get?
Yes, the flu vaccine.
Yeah, once they are recovered, for if you mean the COVID, we need like the full recovery definition.
No, just general febrile illness, non-COVID.
Yeah. Once it's recovered, no more fever for more than 24 hours. Yes, they are okay to receive it. Yes.
Okay. I got
an important benefit of actually like getting the influenza during the pandemic of COVID-19, that it's well reported to have a co-infection of COVID-19 and influenza, and that will make the disease overall is severe and difficult. So getting the vaccine itself, preventing like someone from getting ill because of flu, make it less likely for them to have a more complicated course if they caught the COVID-19. So this is indirect benefit of influenza vaccine during the pandemic. Another direct benefit actually in a society and the community where we do vaccinate people for influenza, it actually decrease the burden on the health system. If you divert those like with influenza related complication and need for hospitalization, where the activity of the COVID is ongoing, that will help to relieve the health system. And maybe you saw that the Minister of Health mentioned that the rate of influenza related complication is like reduced much in comparison to the last year. Not maybe yearly because of the vaccine, but I think we believe it's related to the precaution that the people are taking because of COVID, which basically protect them from getting the influenza, which is the general precautionary measure for all the respiratory illness, where we do have a social distancing, frequent hand hygiene, and universal masking. So we need really to keep going with the same thing till we inshallah pass the pandemic, and then even thereafter as well.
Excellent, excellent. So actually that was one of the comments that, yes, like this is a good, the precaution does work, whether it's COVID or the camera floor. Excellent point.
Yeah.
I got again is question about Dr. Shada about the checkpoint inhibitor, which are the specific therapy for certain cancer, and some of the our audience still think they are contraindication even to the killed fires. That is specific checkpoint inhibitor for chemotherapy. Would you still agree that the checkpoint inhibitor per se is a specific contraindication for the killed fires as well? I just want to clarify because I received two questions about it.
Okay, doctors. Any patient in combined checkpoint, for example, for ipilimumab or nivolumab, because of potential associating with immune-related adverse reactions. So we suspect in this patient, because low immunity, it is better to not take influenza vaccine while he is in immunocompromised drugs. So we prefer to not take it, just take a precaution, because we fight the influenza vaccine by, as I mentioned, by 3.5 vaccine, and by take general precaution, use hand rubbing and general instruction, and by using antiviral medications. So it is better to not take the flu vaccine at that time, for even for a killed vaccine.
So it's only that inhibitor, correct? There's no other medication that we are aware of to prevent us from the flu vaccine.
No. Yes, you are right, doctor.
Excellent. Dr. Ali, any other medication that we should keep in mind apart from the checkpoint inhibitor?
No, like one medication that we need to make sure that is not given, which is not related to the vaccine itself, but to the influenza infection, which is like the aspirin, when we give it for children because of Reye syndrome. And this is like for the infection, but not for the vaccine. So I'm not aware about any other medication that we need to have some concern about for the flu vaccine.
Excellent. Really great safe, effective vaccine. So when you go through the actual contraindication, I would say 99.9 there is none. Like literally, except for those patients who are on the combination of checkpoint inhibitor. Other than that, it is indication rather than contraindication. Dr. Ali, the risk of GBS after flu vaccine.
Yes.
As a side effect.
Yeah. So like, you know, the GBS, if it is like happened recently for the past year, yes, maybe like some concern about it, not to give it. Like if you go back to the initial data about the GBS was in 1976, when they found some increase in risk of getting a GBS. But however, like later on, another study did not really substantially define that the risk is substantial because of it. Like there is one trial actually, they found that the risk of GBS because of the influenza infection is 4 to 8 fold more than if you get the vaccine itself. If you get the infection is 8-fold more than the getting the vaccine. So the association between those, we cannot say causality, but it's more of association. It's like it's rare, very rare, or talking about 1 or 2 per million. And if it's not really truly associated with many infections, enteric infection can lead to GBS, but I don't see it like as a true contraindication. However, like it's a benefit of doubt. If it's recently happened, that could maybe like, you know, not to give the vaccine because of it. But however, during that period, recent period of a year of acquisition of the GBS before the vaccine.
Thank you, Doctor. Dr. Shadal, we have a question about you giving the vaccine while somebody on antibiotic. Let's say the person is on antibiotic for non-respiratory condition, for let's say for cellulitis, and they want to receive the flu vaccine. Is that patient being on antibiotic is a contraindication for the flu vaccine, or still you can get?
Okay, actually the antibiotic is given to treat any patient with a bacterial infection. As we know, the influenza is a viral infections, and the flu vaccine, it is protect against the viral infection. That is why there is no contraindication to give antibiotic with the influenza vaccine. It is a safe with no any precaution regarding that.
Excellent. Dr. Ali, if you with the question I received about flu vaccine and post-vaccination appendicitis.
Post-vaccination appendicitis?
Yeah, appendicitis. The patient got appendicitis. Bad luck?
So I couldn't get the question, sorry.
So one of the audience asking, is there any relation between somebody who get the flu vaccine then ended up having appendicitis within 2 weeks from the vaccine?
No, there's no any relation actually. Like appendicitis, if you go, it's a bacterial infection. It's nothing really has to do with a killed vaccine that induced the immune system. There is no direct or indirect relation with having a bacterial appendicitis after getting the flu vaccine.
Okay, so
if I understood the question right.
Yes, and you get the answer. Thank you very much, Victor. Doctora Shada, what to tell your primary care colleague who are still hesitant about giving a flu vaccine to pregnant ladies?
Okay, as we know, the flu vaccine is already distributed in all primary health centers and available for all populations and with the free of charge. And the benefit of flu vaccine is a lot. So just be strong and advise your patient to take the vaccine, because it may you are help them and decrease the complication and consequence if they didn't take the vaccine for this year.
Excellent. Dr. Ali, literally, really after hearing your lecture with Dr. Shada, I would say like denying to give patient flu vaccine can be classified as malpractice. Would you agree with this statement?
I would say like for the high risk, yes.
What about you, Doctor? Will you classify it as malpractice to withdraw or not give the patient the flu vaccine?
Sure.
Okay, okay. Okay, so we're gonna now shift gear a little bit about the COVID. Dr. Ali, في two countries approved the vaccine the COVID. Would you share with us as our expert, what do you have to tell us about the COVID vaccines?
Okay, so now like basically two vaccines. Just to let you know, like there are more than 100 candidate vaccine actually like under trial, more than 100. So the two of them, like basically like maybe you heard that like in the press release about their initial efficacy, and the Moderna as well as the Pfizer one. And the Pfizer one is like actually is approved by the UK, and actually according to the press information like and release, like you start from the next week actually like to utilize it in the UK. And even the US FDA is also receiving a request to review the vaccine to approve it, as well as Moderna did, and asking the FDA there to look at their vaccine. So the Moderna one is like with about talking about efficacy of nearly 95% and 90+% for the Pfizer the vaccine. So both of them, they passed through the phase 1 and 2 and 3. And where like when we look at the vaccine development, we are talking about two major things, which is the first of all the safety, then the efficacy. Like is it safe? Is it effective? And actually, like in history, maybe this is the first time for a vaccine to be launched, to be utilized, and we are talking about less than 12 months. This is an achievement actually. Yes, I don't worry. The initial information that everyone got like in the media is really promising. But just to let you know clearly, like currently there is no any data shared with like expert review, like in terms of like the safety data, the efficacy. So there are still, if you are talking about the scientific talk and the feedback about it, it's still like there's still uncertainty. It's a promising, of course, the data they share with their authority at the UK or US, it's promising. That's why it got approval. But the final say, the final talk, it's really early to say it now, because what we get is just only from the media now. So that's why we cannot give any like a clear, solid input about it. When we are talking about the phase 3, yes, it's in 10,000 and showed safety and efficacy. But what you need to do it as much larger scale, where you further assess the safety and efficacy and what the performance of this vaccine in elderly and the people with high risk. It's not as a voluntary, healthy volunteer. So we are optimistic. Yes, the initial things that we got is promising. Hopefully, inshallah, it will do the job and will be good. But I would rather say, stay tuned. Let us wait for the scientific data when it's shared with people and to get the initial feedback, post-marketing response to the vaccine agency and also from our authority and through the Ministry of Health. And till then, we just will wait for the other further information, inshallah.
Dr. Shada, I would like to hear from you as a frontliner of primary care. What's your expectation from this flu vaccine, from this COVID-19 vaccine? We heard from Dr. Ali. He's a subspecialist in infection control. He all about vaccine and infection. What about you as a primary care?
Okay, well, doctor, regarding the COVID vaccine, still there is a lot of study. We are follow the news as a general populations. I think we reached to advanced point in this area, and we are a full support. If it is available here, we are a full support. We're advising our patient to take it because the benefit of getting a vaccine is more than getting a COVID. And we save a lot more regarding the complication of COVID-19. So regarding for me, I will full support. I give it to my patient if it was available.
Dr. Ali, like that's a very interesting question from the audience. يقولون ما شاء الله الحمد لله يعني we are here in Saudi, we've shown a really good way of handling COVID. Our numbers are really good and still declining. Why we would need the COVID vaccine with all the concern about safety, efficacy, etc.
Okay, so first of all, like there is no any major actually concern about the safety and efficacy, but what we are saying that we will wait, like, you know, for the confirmation about it. Like the preliminary result is really like showing a by percentage, it's really effective, 90%, it's safe. Otherwise, it would not reach the phase 3 trial or even like getting approval to be utilized for the human at a large scale. So they are planning now, like next week, 10 million dose like in UK, then it will reach by 2021. You are talking about 1 billion vaccine it will be produced. So they will not reach to this level without having a clear concern about its safety. But it's like initially safe, but sometimes you need to confirm and to have a solid evidence based on the safety for the long run. So the thing that why we do we need it, we want to break the cycle. So we don't want really like the COVID-19 to continue, because the impact, the morbidity, the mortality will continue if you don't stop the virus from being circulated among the community. So definitely every country, everyone is really eager to take the vaccine. So we want to prevent, so what could happen, you could really prevent a lot of thousands of admission, morbidity, mortality if you get the vaccine. So what we are doing, alhamdulillah, overall situation, the kingdom is much better than from outside, related to gladly with the support from the government, from Ministry of Health, and even from the awareness, definitely from the public about the general precautionary measure that they are following. And with that, actually, we were able, alhamdulillah, with collaborative work from everyone to control the extent of the spread. However, this cycle, for whatever reason in the future, if people get lax, they were not following anymore like the precautionary measures, the cycle could really like, again start with a spike, with another wave. And that's why the vaccine, it will help us to end this story, to end this pandemic. So indeed, it's like, it's a dream. It's the, the things that everyone wants in every country, without any doubt.
Dr. Shada, I got a question I'll share with you, and next with Dr. Ali. So we know we spoke a lot about the precaution for flu in general and for the COVID. Is there any dietary intake that might help raise the immunity, whether for flu or for the COVID? Like, can we take certain foods, certain vitamins to help fight the flu or the COVID? Dr. Shada?
Actually, the flu and COVID, all other virus, so we can protect ourselves from follow the instructions and take continuous rub hand and wash hand. Also with the healthy food that maybe increase your immunity. Also protect yourself from crowded area, and follow any instructions regarding the Ministry of Health instructions. A special thing I couldn't remind now, but maybe Dr. Ali, he have some point in this area.
Any
Dr. Ali? So like basically, like about even maybe you hear during the COVID, like the people tend to consume more like citrus, like things like vitamin C, or even taking tablets of vitamin C. And the initial trial done for the COVID, and they were even using the vitamin C as an IV with high dose, but actually with the promise that could help the immune system and to support against the infection of the COVID, but actually the trial came negative. So initially with the new pandemic, new virus, everyone is really eager just to know whatever that could help, and they will try, but not that's necessarily to be a true. So there is no any evidence about any element, vitamin that proven to be effective for COVID, for influenza. However, but if you take it collectively, as Dr. Shada mentioned, the healthy diet, enough sleep, a lot of water, and someone getting rest, all this will like support the whole immune system to fight back any infection, not specifically the COVID, not specifically the flu, but to be specific, nothing really proven, like from diet-wise, that has any like impact in preventing or even like, decreasing the severity of any sort of an infection. But it's a whole like package of getting enough things to support the body to do its work, and part of it is the immune system.
Okay, so I just received a question. Somebody with the flu, how long, Dr. Shada, we should keep them away from work?
Usually first 24 hours you should stay at your homes, and if the fever is still continuous, it's better to isolate you at your home unless the fever subside and you become better than health. But regarding the work, a lot of studies said the first 24 hours of getting fever related to the influenza is better to stay at home.
Okay. And in the arena of COVID, Dr. Ali, is there any difference recommendation to how long we should keep people home after they get flu?
No, like if they confirmed flu, as Dr. Shada mentioned, it will stick with the same guidance. And if it's not classified, like it was not confirmed, we need really to make sure it's not a corona, not like flu. So, but if it's confirmed flu, we just exactly the same recommendation.
Okay. What about zinc for common flu, Dr. Ali?
Sorry?
Zinc for flu.
Yeah, so for flu, there is no any like solid evidence about the recommendation of zinc. It was more like with the COVID, and they said that might be of benefit. However, again, they could not really conclude a solid recommendation about the zinc. So whether it will be, but at the end, it's an element that can be utilized with no harm based on the benefit of doubt. But that is not also for the influenza. There's no any certain recommendation for zinc to recommend for the flu.
Okay, I will conclude with the Dr. Shada. Can you take home message from your side, and we'll hear from Dr. Ali as well.
Okay, regarding the influenza is a common disease every year, so we can control it by keeping each hand together with a simple thing. Just follow the instructions and get your vaccine. It was available in every primary health center, in every hospital with charge free. And if you have any symptoms of influenza or suspect you are influenza, just go to your doctors and seek advice. The doctors will help you and guide you regarding that. And as I said, the flu is in with you, so protect yourself and take the flu shot.
Some take-home messages, Dr. Ali?
Yes, so the influenza vaccine is safe, reasonably effective, and please take the vaccine, protect yourself, to protect your family around you, and protect your patients.
Okay, so flu vaccine is safe, effective, very few contraindication, if any, and our distinguished speakers agree with a statement that it can be potentially malpractice to not give it to those with high risk. Before we call us for the day, I just wanna go remind you with the few events that's coming and let me share my screen. So the CCC communication consultation course on December 8th, that's going to be live in the Saudi Society Family Community Medicine Eastern Province. Make sure you get your seat. On end of the year, December 30th, we're going to have a very special event about about the value-based healthcare with the national leader of the value-based healthcare. So mark your calendar for December 30th. A very special evidence-based evening gonna be on exercise and physical prescription. It is gonna be in January, yet date to be confirmed. Stay tuned with us. And now it comes to the end of the evening. Thank you very much, Dr. Rashada. Thank you very much, Dr. Ali. Thank you very much, the great audience. We conclude with 1,000 still with us engaged. Thank you very much. I appreciate the audience. I appreciate the speaker. أستودعكم الله والسلام عليكم ورحمة الله وبركاته.